everyone. This is Kay Denault with Mental Health Association of South Mississippi, and today we're here with Megan Lockley. Megan is on our board of directors, and she's been part of that board for a few years now, and has really been instrumental in bringing resources that she's aware of in mental health to our organization, and just really helping us in so many different ways. So thank you, Megan, for that, and thank you for being here. So
thanks for having me.
let's just start off about if you can tell us a little bit about your background in mental health and just a little bit about yourself.
Yeah, so my degree is from USM. I have an undergraduate degree in psychology and a master's in social work. Let's see, I graduated 10 years ago and started my practicum and internship 2 years prior to that. So I've been working in mental health for about 12 years now. I started in community mental health, went to working in a hospital, in an inpatient facility, doing hospital social work. And now I am currently the executive director of Gulf Coast Family Counseling Agency in Ocean Springs. We are a private nonprofit offering individual, marital, and family counseling to everyone in our community. We see people with or without insurance, and work with people based on their income. So yeah, that's what I'm doing.
Very good. So I think you've told me in the past that you guys are partnered with the United Way of Jackson County. Tell us a little bit about that?
Yes. Yeah, so we are partially funded by the United Way for Jackson and George counties. We've been in partnership with them for, I want to say since the 70s, maybe. It's been decades.
Wow.
And they're such a wonderful resource in our community. They actually have 19 agencies that they help to fund in Jackson and George County areas. They're amazing, wonderful people. We're so happy and very fortunate to have their partnership.
Yeah, that's fantastic. So that's tell us a little bit more. I'm thinking that's your connection with folks who maybe don't have insurance and those kind of things. What all insurance do you guys accept, and how can people make it to you to get some help?
We take all insurances. So we pride ourselves in trying not to turn anyone away, because everyone deserves quality mental health care. We do have a website. It's gulfcoastfamilycounseling.org. All of our information is on that website. But our office phone number, we can be reached at 228-875-6113. At this time, with COVID-19 precautions, we are actually providing telehealth services to all of our clients.
Cool.
We're still accepting new clients, and it's just a matter of right now we want to keep our staff and our clients safe. So telehealth is what we're providing at the moment. We do hope to get back to regular business office, seeing our clients face, but we know that's going to be a process for us to get back to.
Yeah, definitely. Well, I'm glad you were able to share that with us, because I know that your services are so valuable to so many people, and we've been able to refer people over to you guys, and it's always been a good match. So thank you. What kind of things are you seeing? I know, we're hearing people mention how, they feel like they're just cooped up at home, and, those kind of things. People are starting to feel some stress. What kind of things would you say to people to help keep their self balanced?
There are a lot of things that can be helpful in moments like this. If we can really get down to basics, just be mindful of the good and things that we can be thankful for. Gratitude has an astounding effect on our mood, and that's something. Sorry, my dog's in here. If you hear a noise. Gratitude is something that I don't think on a regular basis we do enough of, but it's a small thing that can help relieve a little bit of the stress. There's no way that we're gonna go through this in the best of spirits and all happiness. That's just not realistic to think that way. So just having understanding that stress is normal, then kind of being a little bit on edge or feeling irritable with everything that is going on. We may not have the regular everyday stressors of maybe a job or going and running errands and things like that, but we have new stressors that have come about because of all of this. So it's very normal to feel that way, and just give yourself a break sometimes. You got to step outside in the sunshine for a few minutes. Kids are watching a movie or something. Do that. You need it.
Right. Yeah, I was on another call earlier, and the question was, what are you doing for your physical health right now? And I thought, when's the last time I ate a vegetable? I've eaten so much junk lately, so I really am going to get on myself and make sure that I'm keeping up with those things, because even though we're in a different time, it doesn't mean that we shouldn't be taking care of our bodies. So I'm going to be more mindful of that. Well, good. So Megan has been part of our organization and has chaired an event that we have every year, our Don't Worry, Be Happy event. Thank you so much for all of the work that you've done for that. It's been a huge success. And so we are a little bit in limbo at the moment, but we hope that come July, or maybe it might be delayed a little bit, but that we'll still have that event in some format. So that'll be a little celebration that we have to look forward to. Maybe it'll be a celebration of making it through COVID-19. I don't know. So Megan, yeah, in your experience, what other things should people be maybe looking for with their family members, or people that they're in contact with, or maybe even that they haven't talked to in a while, trying to check on them? I guess, what kind of signs should we maybe be kind of watching out for people?
Well, even though we are isolated away from others, we can still maintain contact with them. If there's anyone that you would normally have a regular contact with and have not spoken to them in an extended period of time, it'd be a good idea to check on them, see how they're doing. Some of us are a bit private about our emotions and are not as willing to talk about those things. So it's not absolutely necessary that you have to try to delve into their emotional state, but just look for, are they communicating with anyone? Have they sought access to any leisurely activities, anything that they would normally do? If they're not doing those things, then that's an indication that maybe something deeper is going on. When we stop doing our regular daily activities, that's an indication that there may be an issue going on that needs to be dealt with.
Yeah, I was talking to somebody the other day, and they said, oh, I'm working from home, so I haven't had to wear makeup in a while and, get dressed up or anything. But I think that we should still, at least change our pajamas every day, and make sure that we're keeping up with some of those things. Because, you can kind of get in a rut and just not feeling like yourself. So I think you're right. Keeping up with some of those things that you normally would do, of course not, in the broader sense, but just making sure that you're getting up and taking a shower every day, and, checking, like you said, checking on your friends and things like that. Because what we don't want to do is just, and Netflix is great. I watch it too, but if we're watching Netflix 24/7, that's probably not the healthiest thing. At least get up and move around a little bit and, just try to stay within some sort of routine. You think so?
Yeah, I think a good word to remember is balance. We don't always, when times of crisis, which we are all in a crisis right now with what's going on, we don't often practice, I can't think of the word right now. I can't think of it right now. We don't always do things in small ways. We tend to live in extremes. So but now, not that it's necessarily healthy for us, but we should have some expectations. Our tendency might be to do something a lot more than we normally do, especially if it's one of those comfort coping mechanisms. I have noticed that there's maybe a little bit more alcohol consumption going on right now, because we're not necessarily having to get up, go to work, and be responsible for things. And for some people, that does become a way of coping with stress. So that's something to be mindful of as well.
I agree. Everything in moderation is, what I always hear. And also, being mindful of how those extremities might be affecting other people in your household. I have heard that nationally that assaults and domestic violence type situations seem to be increasing, which is worrisome. And I think some of that is just what we're talking about. People don't necessarily have those coping mechanisms of how to, sometimes you just have to walk away for a moment and just not say anything until you get your thoughts together. So, I just hope people really are taking some of that information and thinking about how to keep themselves healthy. And one of the things we're doing actually is on Friday mornings at 9:30, we have a little, we're calling it a support group, but really it's just, it's through GoToMeeting. So if you log in through your computer or the app on your phone, you can see everybody, and or you can just call in so you can talk. And it's just kind of checking in with everyone. What have you been doing? How are you coping with all this stuff? And it's feeling really nice because I don't know. We've been able to we've been able to connect with some people, and we're trying to spread the word. So hopefully we'll have more people tuning in for that. And then on Tuesdays and Thursdays, we have a wellness group, which is just talking about simple, safe, and free things that you can do, just like we're talking about here. Simple things that you can do to keep yourself well. So that information is on our Facebook page if people want to check that out. So Megan, is there anything else you want to tell us today? Is that your puppy dog?
I think, Julep's right here with me.
Wanting to make a TV appearance.
Yeah. I would just encourage everyone to, have realistic expectations of yourself at this time. Just because we are having to shelter in place now, doesn't mean that you can't still try to take care of your physical, mental, and emotional well-being. I always like to think of the Chinese character for crisis and how it includes two characters, one of danger and one of opportunity. So when we're in a crisis situation, we're going to feel that danger side of things, that we need to protect ourselves and stay safe, but there's always an opportunity there if we decide to take it. So
yeah. Oh, I like that.
Yeah.
Thank you for sharing that. That was really cool. I like that. So just want to round this up with a thank you to Megan for being here with us and all of her tips and information. And I hope that you will reach out if you're feeling some stress and you're not even sure if you need some help. Just either call here at Mental Health Association or call Megan over at Gulf Coast Family Counseling, and we'd be happy to kind of talk with you and walk you through what you're feeling. So have a great weekend, Megan. Thank you.
Thanks for having me.